My name is Michael Bamber. I'm a practice consultant at Norfolk Care Connect here at Vantage House.
My name is Sue Lawrence. I'm Library Manager at North Walsham Library.
Hello, my name's Jill Buckley. I'm the Inclusion and Behaviour Partnership Manager working in East Norfolk.
My name's Jo Gardner. I'm a Team Manager in the Employee Service Centre.
Norfolk Care Connect is a new service that is replacing the old access service and incorporating some aspects of what used to be done in the past in the localities. What it is it's a provision where we're able to take referrals and run with them if appropriate, and also pass them over to the community if it's not. We can provide information, advice and at times services. So it's quite a dynamic new service that's going to be providing excellent support to the people of Norfolk.
Council at your library is part of making council and other public services accessible to people around the county. It's basically a basic inquiry and signposting service, and it uses library staff's existing skills at helping people find information.
The Compass Centre was developed by members of my staff and other agencies in the east of Norfolk, because we had a history of young people having to go out of county if we were unable to deal with them locally, and they had to go into boarding provision and be away from their families. And we had a strong feeling that it would be much better for the children if they could remain locally in their own communities, and actually we could work not just with them but also with their parents.
For the people with the non-complex needs, before they may have gone to the bottom of a very long waiting list and their needs may not have been considered for some weeks, whereas now their needs will be immediately considered by an operative, an assistant practitioner or social worker who can look at what they require, look if it meets our eligibility criteria and provide that service through the process of care arranging. They can request provision of service within the same day as the referral being taken.
I think for residents it gives them a choice about where they can access the service. And of course libraries are dotted about the county. They often have very good opening times. My particular library is open 6 days a week and 3 evenings a week, so that does give a good face-to-face service for people. Also, we have a good reputation in libraries of being a friendly and helpful staff, and it's a place that a lot of people feel comfortable to come to.
We were able to change our way of resourcing and allocation of staffing so that we could deliver a much better service for our young people and their families and deal with them in quite a different way to the way we had before.
There's a lot of uncertainty within the HR community because of the changes that are going ahead and not knowing how our current role and what we currently do will look like within the new HR structure. And part of that uncertainty is knowing how we will fit in what we currently do and moving forward and adjusting to change and looking at our roles in a new way.
As a locality social worker, I was concerned as whether the quality of assessments could be adequate from telephone assessments, from what I'd been doing in the community face to face. But what I found is that we are able to produce excellent assessments here through trained workers who are very skilled at using the telephone to get exactly the right information that they need. And we've also got other support agencies such as Norfolk First Support who will be going in to see people and then can give us the eyes that we haven't got through telephone assessments. So we're working collaboratively now to speed the process up for the service users.
Yes, I think staff were a little bit concerned initially about the depth of inquiry they may get and how long it could take. But since training we realised quickly that we weren't expected to do complex inquiries. It was much more a case of a straightforward sort of inquiry, and anything else we would refer on to another department.
I'm quite enthusiastic about the change. I do like change and I like moving forward. I think it's quite healthy It might seem a strange thing to say, but I do quite like moving forward. I think you learn new things. It's encouraging because there are other opportunities that are possibly open to you.
All our assistant practitioners are very new to the task. Nobody who arrived here could do the entire job when they first came because they'd come from one half or another of a very complicated service. But everyone's getting better at what they're doing, and the whole process is speeding up, and it's improving, and we're also able to retain some of the cases that we might have passed the community in the past. So yes, obviously there is room for improvement, but we're not complacent. We're getting better, but we've started well, and we aim to improve for the future.
It's very satisfying when you'll have somebody who'll come into the library. They don't always know where to start with an inquiry, and that's where the library staff come in. For example, that could be about employment law, tenancy agreements, what to do when somebody dies. Sometimes you can visibly see the strain lifting from people as they begin to get help for those sorts of inquiries.